In this morning's Highlight on Health, whether you're caring for yourself or perhaps a loved one, there are some simple steps you can take now for providing quality care outside of the hospital and avoid readmission. Joining us this morning to offer some potential solutions is surgeon Dr. John Sabra. Thanks so much for joining us this morning.
Good morning. Thanks for having me.
So, doctor, whether we're talking about discharging a mom who perhaps just gave birth or an individual recovering from an injury or surgery, what are some of the things that patients and caregivers should consider when leaving the hospital?
The most important thing is education, for sure. And patients and their caregivers need to get with their primary team, their physician, their nurses on the day of discharge and educate themselves as far as what the care at home is going to be like and what that transition is going to be like. So it's a team effort for sure. And that's why I'm here now trying to get the message out with Cardinal Health as far as informing patients and giving them the resources they need to hopefully be more comfortable at home.
Yeah, why is the discharge planning process so important?
It's important to hopefully avoid the obstacles and traps that can occur if a patient goes home uneducated. So sitting with your doctor, and if it's a surgery patient, like in my example of my patients, talking about their wound. What do I look for if it's getting infected? What if my pain control is not adequate? Talking about all those things before they leave the hospital can hopefully 2 days later prevent that trip back to the ER at midnight. And these are the kind of things that patients and their caregivers need to get together and talk about before leaving the hospital.
So what are some home care tasks and products that could affect the quality of life of a patient?
The areas are going to differ depending on the patient's diagnosis, of course. In surgery, the biggest thing we'll see are wounds, potentially post-surgical wounds, or even chronic wounds. There are 6.5 million Americans dealing with chronic wounds every day right now. How can they take care of those wounds? And products out there are available to help bring that hospital quality to home. So cleansers, gauze, topical agents, pads, things like that for wound care. And then simpler first aid type products. Perineal cold packs for new moms, warm packs for strains, and then durable goods. So patients who need help with walkers, crutches, wheelchairs, and things like that. Coordinating all of that before you leave the hospital is going to be important to making sure when you get home you have that high quality of care.
All right, Dr. John Sabra, thanks for joining us this morning.
Thanks so much for having me.